Hello, everyone. Good evening.
Good evening, Dennis.
Good evening, Tony. Okay. He's my one-man fan club over there. I'm Dennis Conway. I'm the president of the Healthcare Executives Club, an illustrious position that anyone else could take from me if you like, right away. Any comments? No? Okay. I just want to mention, before I introduce Marcia Thomas Brown, the chairperson of our program committee, that with us tonight is Steve Phillips, who is the president of the New York State chapter, regional chapter, right, of the National Association of Health Service Executives. Steve, I'm glad you're with us. You came. And another celebrity is Tony Ferrante, who is the former president, right? Former president, although sometimes they still think you are the president, right?
No.
Okay. And I got to read this, Tony.
Responsibility.
Okay. He's of the New York State chapter of the Healthcare Information and Management Systems Society, otherwise known as HIMSS, right?
Yes, thank you. Everybody's doing it.
Glad you're with us. So, and also I want to bring to your attention Dr. Manish Shada, Dr. Shada in the back there, who is a director at Northwell Health, and he was the one who helped us make arrangements here. Apparently the requirement is you need someone on the inside to get in, and so he was our inside guy, you might say. Thank you, Dr. Shada. And also, Samantha Riker. Samantha is over here at this table, and Samantha was very helpful also in making that connection for us. She too is a member of the Healthcare Executives Club, but also she works here at Northwell in this building, right? Yep. Right here, okay? And if anybody wants, you can go downstairs to her office and use the computer, right? But Samantha was very helpful in making the arrangements so that we, in turn, could have this event this evening. That's a cue. He gives you the cues, right? Instead of having a sign that says applause. Okay. So with that, I'm going to turn it over to Marcia and let her make the further introductions for the evening.
At this point, I'm supposed to say thank you, Dennis. Good evening, and welcome to this timely collaborative dinner and educational program. And as Dennis mentioned, this program is in collaboration with four other professional organizations. We just mentioned two of them, the National Association of Health Services Executive and HIMSS. And in addition to that, we have the New York Risk Management Society and also the Black Long-Term Care Executives. And we've been working with these organizations for a while, and we welcome their support and their input. A couple of informative notes for tonight. This program is being recorded and is approved by NAB for 1.5 continuing education credits. Once we complete our edits of the program, it would be made available to you on YouTube. See, we're moving up in the world. We're heading to YouTube, so you'll be able to see this program on YouTube. Thank you, guys. In addition, you have a yellow sheet on your table. Please complete. That's the survey. And please complete it. Be honest and provide us with information, because this is part of our planning tool that we use for our future events. At this point, I'm not sure how Jonathan is going to handle it. Usually what happens is we wait until the end of the presentation and you can ask questions. I'm not sure of your comfort level if you want that, or they can ask in between, or you're okay with either? Okay, with either, so. Now, let's get to, and bathrooms, very important. You see Dennis, I'm making the note, bathrooms, the exit door will take you to the bathrooms. Very important information. Now, let's get to the why we're here tonight. Our topic is entirely appropriate and timely considering our upcoming November presidential election. That is really a cornerstone of changes in the entire country, and healthcare is not out of that realm. We'll be looking at a journey into the policies that impact healthcare organizations as it stands today. But looking forward to, depending on who is elected president, will make a difference in our specific future tomorrow. So get involved, put on your thinking cap, feel free to ask questions and make comments. This is not a one-person presentation. You have diverse backgrounds and you work for different organizations. Some may not even have been a health organization, but if it ties in, if you have questions, please get involved. The presenter tonight is Jonathan. He's the Senior Policy Advisor in the Healthcare Group from Alston and Bird in Washington, D.C. And thank you very much for traveling this far to New York City. I don't know others that are familiar with Alston and Bird, but I am very familiar. I worked in D.C. And so welcome. And as I said, we New Yorkers actually selected this day just for you. Beautiful, beautiful spring day for you to come and visit with us today. He analyzes, design, manages, and directs the federal advocacy strategy for healthcare clients across the industry. Before joining Alston and Bird, Jonathan led the Congressional Affairs Division of the Federation of American Hospitals, representing nearly 1,000 community hospitals and healthcare systems in both urban, rural areas in 48 states, Washington, D.C., and Puerto Rico. Very extensive background in advocacy and also in working in the policy element in Washington, D.C. You have part of your attachments that we provide to you, his entire background information, and so rather than standing here and reading it, feel free to look at that in terms of details. With that in mind, Jonathan, please, let's welcome Jonathan. Warm welcome. And it's all yours.
Okay. Well, thank you. Thank you, everyone, for coming out. Oh, I've been instructed to ask you to turn your cell phones off. Or silenced. Thank you all for coming out on this beautiful night to talk about healthcare and politics, which is everyone's two favorite topics of conversation, but hopefully we'll have a good time tonight. And I welcome questions along the way. I think we're a small enough group that we can hopefully have a conversation and a dialogue, which is not very common in Washington, D.C. anymore. And you can ask me anything you want about healthcare policy or politics or what's going to happen in the election. I can make up a whole bunch of stuff, and maybe you'll believe it, maybe you won't. I'm excited that this is going to be on YouTube because I was a failed child actor at one point in my career, so maybe this will be my opportunity to get famous again. But you can ask me about that too. But I want to thank Dennis and Marcia and everyone here again, and all the hosts for tonight, and for the lovely dinner buffet as well. So let's kick things off. So here's a little bit of background about me. Marcia kind of went through it. So where I am now, I'm a senior policy advisor with Alston and Bird, and that is an international law firm based in Atlanta, Georgia, but I'm in our Washington, D.C. office, and I'm part of our healthcare group. And essentially, we represent a diverse coalition of clients, everything from providers to payers to medical devices. And here's a good question. Does anyone know what a lobbyist does? Okay, I see some people. So what does a lobbyist do? Because I get asked that question all the time, usually by my parents. What a lobbyist essentially does is they advocate on behalf of the association they work for, the client they represent, the corporation they represent, or the association or entity that they belong to as members. And they go to Capitol Hill or to the administration and they advocate for what their policy priorities are. And sometimes that means advocating in support of legislation, advocating for the introduction of legislation, advocating in opposition to legislation. And it's kind of a unique, obviously it's embedded in our First Amendment, our right to petition the government. And it's a really exciting time to be a lobbyist. I know there's always, kind of a scarlet letter on what lobbyists do, but it's really an important part because at the end of the day, all of these congressional offices, they're very, very busy. And the staffers who work for them are dedicated public servants, often very young, but very influential. And unfortunately, they just don't have time to meet with every single person. So it's really important for them to meet with associations and groups of individuals who are collectively speaking with one voice. And that's why it's good to have lobbyists and offices in DC or come into DC for fly-ins so that your voice can be heard on Capitol Hill. So that's what I do now at Alston and Bird. I've been there for about a year. Before that, as Marcia said, I was at the Federation of American Hospitals, which represents about 1,000 for-profit hospitals and health systems across the US. Of course, New York does not have any for-profit hospitals. And that was a really exciting time. It was a very challenging time that I was there. I was there about 5.5 years. I was there for the surprise medical billing negotiations and then all the way through the COVID-19 pandemic, which we can talk about as well. And then prior to that, I represented an association that collectively represent all the state medical and osteopathic licensing and disciplinary boards in the United States. So that's just a little bit about me. And again, I started my career, graduated college early in the mid-2000s so that I could work on political campaigns in Illinois and then somehow found my way into healthcare and have been doing it for about 15 years now. All right, went for me. So what are we going to do tonight? Essentially, we're going to talk and do a quick review of what the Biden administration has done in the last 3.5 years or so, what the Trump administration did in its 4 years prior to the Biden administration, what their goals were, what they sought to achieve, what they were able to achieve, and then ultimately what they were unable to achieve. Then, of course, we can talk about whether or not what Mr. Biden and Mr. Trump would be able to do in their second administration. Of course, there will be many constraints and challenges, and of course, the unknown. So, as I just said, what has to happen, what's feasible, and what's plausible. So let's set the stage. We don't know where we're going, but we know where we've been. And here you can see Grover Cleveland, the only US president to serve 2 non-consecutive presidential terms, and then Dwight D. Eisenhower, the only person who ran against the same individual twice and defeated him, Adlai Stevenson. So this is unique times. We have a former president and a current president running against each other again. I think what's also quite notable about this election is the vast, vast majority of Americans do not want either of these two people to be their candidates for president. However, that is the situation we are in. There are, of course, some third-party candidates, but at the end of the day, come January 2025, either Joe Biden or Donald Trump will be inaugurated as president. So going through the policy priorities for President Biden and President Trump's first terms. We'll start with President Biden because, of course, that's the most recent. That's what we're currently living in. As soon as the president was inaugurated, he put an extreme emphasis in his administration on equity. He made a number of historic appointments and also wanted to use the federal government as a means to ensure that there was a more equitable distribution and availability and access to healthcare in the United States. He also focused on good government and leveraging antitrust authorities, which there is currently a lot of focus on non-competes, consolidation, competition in healthcare, and we'll talk about all that in quite a bit of detail. So when the president was inaugurated, the first thing he was, of course, faced with was getting us out of the COVID-19 pandemic. Immediately upon taking office, he passed a major piece of legislation that was passed through the reconciliation process, which essentially means only Democrats voted for it, and then the president signed it. And that provided a whole host of things to stimulate the economy, everything from personal checks to taxpayers to hundreds of millions of dollars to state and local governments, and then continued support for hospitals and health systems that were still reeling from the impact of the COVID-19 pandemic. Of course, the president is incredibly proud of his record at the moment, and you can see here what he indicates, helping the nation get out of essentially what could have been a catastrophic depression. 15 million new jobs created since January 2021. Unemployment rate is at one of the lowest stretches in more than 50 years. Wages are continuing to rise. The stock market is at an all-time high. Inflation is down, but of course was quite high for quite a while, and that challenge still continues. But I think you can see here this quote from the president when he first took office. How many families, he often says, are missing someone at their dinner table. And I know many of you, most of you, if not all of you here in New York State were really at the epicenter of the COVID-19 pandemic, from day one. And, I just personally thank you for everything you did. I mean, it was just something we didn't know what it was, when it started hitting our shores in the end of December 2019 and really grew from January to March 2020 before the lockdowns. And, not only were 1 million plus lives lost, people are still suffering with long COVID. Hospitals, as I know you all know, are still struggling, coming out of it with increases in wages, inflation, supply chain challenges, etc. We can talk about all those things tonight. But Americans themselves also suffered, losing their jobs, losing their homes. Also, the struggle of being isolated. And we now have a mental health crisis that is particularly prevalent in our youth at the moment, and that's something we're going to have to address. But it is something that the president really put his entire administration behind in the first 6 to 8 months of his presidency, and that was getting us through the COVID-19 pandemic. We'll talk more about vaccines and the rollout of all that just momentarily, but in terms of coverage, he ran for president against Bernie Sanders and other members of the Democratic caucus, many of which were advocating for Medicare for all, or a single-payer national health care system. President Biden took a more measured approach. He took a position in, of course, full support for the Affordable Care Act, the signature landmark legislation that President Obama passed during his 2 terms, but also looking for ways to enhance it, expand it, and make it last in perpetuity. President did, at one point during the campaign, come out in support of a public option, but we can talk more about that, but that kind of has fallen from the wayside. But immediately, coming out of COVID, when millions of Americans were threatened with losing their health insurance, potentially being dropped from Medicaid, that's where the president put his priority. And where we've seen now is we have 21 million consumers enrolled in the ACA plans for 2024. ACA is not perfect. I think President Obama and President Biden would be the first to tell you that not everyone has been covered. Of course, many states, although a dwindling number, still haven't expanded Medicaid, which has caused a number of individuals across the United States to remain uninsured. But 45 million people now have coverage through the Affordable Care Act, thanks to the Marketplace and Medicaid expansion. So I think where the president wants to take that is going to be a major part of his re-election campaign. So the Inflation Reduction Act. Once the president felt we were out of the COVID-19 hurdle, he sought to use reconciliation. Again, that's a legislative process where you don't need that 60 votes in the Senate in order to break a filibuster, that you can use it through budget reconciliation in order to pass with a 51 vote majority. So at the time, the president controlled the White House, Democrats controlled the House of Representatives with Nancy Pelosi as Speaker, and then Senator Chuck Schumer, your senator, of course, led the United States Senate. The Inflation Reduction Act, which originally was entitled Build Back Better, was a grueling 8 months, maybe longer, maybe less, of rumors, negotiations, folks in DC all saying they had to know, they knew what was going to be in it. Folks were calling for $10 trillion in spending in government programs and tax increases. Then, of course, week after week would get scaled further back down. It would fall apart. It would go away. Then it would come back. There'd be a sign of hope. Essentially, Senator Joe Manchin of West Virginia and Senator Kyrsten Sinema of Arizona kind of both held the reins of what ultimately could be included in the Inflation Reduction Act. But there were some really, really important healthcare components to that bill. Here you can see the Inflation Reduction Act limited the insulin cost to $35 per month for Medicare beneficiaries starting in 2023. So that will impact 4 million seniors in the United States. And I think a lot of the companies, the corporations, the insulin manufacturers saw the kind of the writing on the wall and also decided that, it was perhaps appropriate to lower their costs of insulin. So we've seen an across the board decrease in the cost of insulin in the United States, but the job is not done. I know the president and the Democratic caucus and members of the Republican caucus as well are working towards expanding that $35 monthly cap to the commercial market as well. The other major Medicare drug costs has been a huge priority for President Biden. And in the Inflation Reduction Act, after decades of trials and failures, the Congress ultimately did pass the ability for Medicare to negotiate drug prices for a limited select group of drugs that will continue to expand over the years. But this was really something that was historic, that had been debated and fought for years and years and years, but it was ultimately cut to federal deficit by $160 billion, and there will be ultimately 500 different drugs over the next decade that will be subject to this negotiation process. The first round is actually going on right now. At the same time, certain pharmaceutical companies are suing on behalf of or against the Inflation Reduction Act. But there were other provisions in the Inflation Reduction Act that were important too, limiting rebates to inflation, no cost sharing for vaccines for Medicare beneficiaries, expanding access to the Part D low income subsidy. We already talked about the negotiated prices. And then, of course, capping Part D out-of-pocket expenses at $2,000, which will be going into effect soon enough. President Biden has also put a great bit of emphasis into research, ARPA-H, which is kind of one of his signature priorities. Women's health research, $12 billion put into that to benefit women. And then, of course, with the Supreme Court's action to overturn Roe v. Wade, reproductive health has become a top priority for the administration and will continue to be a major focal point in the election ahead. So now let's go down memory lane. President Trump, elected in 2016 in an election that very few folks thought he would win, but he, even prior to taking office, had built a pretty robust agenda of what he wanted to do, including in healthcare. Overall, big ticket items. He certainly sought to reduce administrative and regulatory burden, pull back on a lot of regulations that were either outdated or no longer of use, to allow for physicians and providers to focus more on their patient care. Competition has been was a huge priority for President Trump, and we'll talk about that, how he focused on association health plans and short-term insurance options. Transparency. The president put forth a rule that was finalized that required hospitals and insurers to disclose their negotiated prices on a easily accessible platform on their websites. And then, of course, increasing economic growth. So, as I just mentioned, price transparency. The president felt that one way to drive down the cost of healthcare was to allow patients to shop, to have a greater understanding of what their healthcare costs would be. Why are certain procedures cost more at one facility or with one physician than with at a different facility and a different physician? And the thought process there, of course, was that competition would ultimately lower the cost of healthcare in the long run, and also allow patients to save their resources. Trump also, like President Biden, put a great deal of emphasis on drug pricing reform. He looked at ways to utilize reference pricing for Part B drugs, biosimilar competition, a rebate rule, drug importation, a most favored nation, not allowing the United States to pay any more than our nearest competitors. And even when President Trump ran for office in 2015, he campaigned heavily against the role of pharmaceutical companies and their exorbitant prices in healthcare. And then here's some of the insurance options we talked, things that he felt would help drive down the cost of healthcare in the United States. The relaxed short-term limited duration insurance plans, that has of course been pushed back by the Democrats, expanding health reimbursement arrangements, expanding health savings accounts, and changing association health plan rules. And a lot of these ideas weren't necessarily new, but have typically been part of a more conservative approach to drive down healthcare costs. Then COVID hit, and everything that the president was working on in healthcare fell to the wayside, and the priority became addressing COVID. Launched Operation Warp Speed to expedite the process of vaccine development and approval, creating a public-private partnership with Pfizer, Moderna, and other stakeholders out there to ultimately deliver the COVID-19 mRNA vaccines. Ways in which to expand production using for supplies, gloves, masks. Don't have to share all of you. I'm sure all of you remember those days very, very well. And then ultimately with a goal of distributing about 300 million doses by 2021, which was an enormous feat to find a way to get all those doses out and about and distributed across the United States. So where do we go from here? And before I go on, let me ask if there's any questions with the first terms of President Biden and President Trump. Dennis.
So is the transparency is this a transparency of your charges, or is it transparency of the rates you're actually going to receive?
I believe it is the master charges as well as the negotiated rates.
Because if it's the charges,
Right.
it really doesn't tell you.
But it's the negotiated rates as well.
Secondly, since most people are covered by a third-party payer, how does it really make a difference? If I'm going to choose between Dr. X versus Dr. Y, and I notice one charges double what the other one charges, but he happens to be better than I mean, quality-wise, clinically, I think he's better. What's to prevent me from using the higher-cost doctor if my third party's going to pay for it? I mean, I pay premiums anyway, so let them pay for it, right?
You make a very interesting point, one that many have raised, including the hospital associations in Washington, D.C., when they fought back against the rule in the court system. I agree, about 180 million Americans are covered.
It would be embarrassing, I suppose, if one doctor is charging 4 times what another doctor is for the same procedure. But he might say, well, what do I care? They're going to pay me anyway.
That's essentially kind of the philosophical question.
And in the end, the negotiated rates are usually rather equal between providers, aren't they?
There are variations. Yeah.
But if there's a doctor at this location, there's not a doctor not too far away, they're going to get pretty much the same rate, right?
Sure.
Regardless of what their charges
I will say, in addition to both the Trump and Biden administrations, there is a growing appetite among an educated consumer for more transparency in healthcare. And there's a very powerful, influential think tank called Power to the Patients. You may have seen some of their ads that have run during like the Super Bowl and the Academy Awards. Fat Joe is one of their spokesmen. They have the ear of Congress and the administration in saying that hospitals and certain providers have charged patients for, without much transparency, and it's time that there be more transparency. Now, I think you make an interesting point. Like I said, hospitals made this argument in the early days when those rules were being proposed, that ultimately what's most important to a patient is what's going to be their out-of-pocket expense. What's their copay, what's their deductible. Now we can talk about surprise billing, but what would be any sort of surprise billing if there was an anesthesiologist or a radiologist that wasn't in network sort of thing. But I think at the end of the day, hospitals and folks have kind of just taken a step back, and there's legislation that has passed the House of Representatives, the Lower Costs, More Transparency Act, that passed on a large bipartisan basis that essentially would codify and make some alterations, but would essentially codify what the Trump and Biden administrations have done in terms of hospital price transparency. So that's a long way of saying it's here to stay.
I just question whether it's really an initiative that is going to bear any fruit when it comes to reducing the overall cost of healthcare.
It's a fair question. Yes.
I'm really confused with this. Like you started your speech with saying that health equity. Health equity, you see, it's different in different categories and different groups. Could you please elaborate?
Sure. So health equity, there probably isn't one grand definition of it. I think what the Biden administration focused on was that not only the wealthy would have access to healthcare, that we would have a greater focal point on maternal mortality, health disparities in low-income communities, ways that we can help fight back against that sort of thing.
What are your thoughts on individuals like Mark Cuban entering the pharmacy space?
Well, of course, I'm not representing anyone here, so I actually don't really have a particular opinion about that. I think he's doing something very interesting because he's trying to take the middlemen out of the process, and it'll be interesting to see if ultimately it is an effective way to do things. There's a lot of different models out there that are trying to do what Mark Cuban's doing. Other hospitals and health systems are working on developing their own generics to help deal with the supply chain issues and shortages. Okay, well let's dive into 2024. So what does President Biden want to do? Should he be reelected? He wants to. So we talked a little bit before about public option. I think it would be very unlikely that you'll hear President Biden on the campaign trail talk about public option. I think what he's going to talk about is the success of the Affordable Care Act, but room for improvement. And during COVID, in the CARES Act and other pieces of legislation, what they ultimately did was expand the subsidies and allow for more people to access the marketplace and at a lower cost. That those subsidies were then extended again as part of the Inflation Reduction Act. That was another key component of that provision or that piece of legislation. But those subsidies end in December of 2025. So it's only about a year from now. And I know a lot of folks, even in the insurance companies, they kind of hope that Congress will deal with that sooner rather than later because they have to do their planning for the year ahead for their rates. It's going to be a slog to get the ACA subsidies extended beyond 2025. It is not cheap. It would certainly be seen as a Democratic ask. So should the Democrats pursue it and necessarily don't control both the House and Senate and the White House, they're probably going to have to give something up if they want it to get something, to get the Republicans to go along with it. But there are also Republicans who have acknowledged that the subsidies have really helped a lot of families get that coverage. Additional drug negotiation authority. President Biden, I believe in a State of the Union, said the Inflation Reduction Act was very much a start and should be expanded in the future. And then, of course, federal protection for abortion rights. And we're seeing now all of this played out in the courts. There's the Idaho case that was just heard before the Supreme Court about EMTALA and determining whether or not hospitals can and should perform an abortion in certain emergency settings. That decision should be made in June. There is the FDA's drug approval for abortion medication. So there's a couple of major pieces of legislation, decisions that are going to be coming out of the Supreme Court this year that will probably be a big part of the 2024 campaign season. Now let's turn to President Trump. What does he want to do should he be re-elected? He has said he's interested in repealing the ACA. I would say the chance of him pursuing that is pretty unlikely. You'll of course remember shortly after his election in 2016, he did pursue the repeal of the Affordable Care Act. It ultimately did pass the House of Representatives, but failed in the Senate because of Senator John McCain voted no on it. That was a very frustrating time during the Trump administration. There were a lot of consternation within the White House about whether or not healthcare should have been the first thing that President Trump should have tackled. He was a businessman. Should he have gone for infrastructure? Should he have gone for a tax bill? Why was healthcare the first thing they did? And then ultimately, they did not come up successful. Yes?
Think of this scenario though. If he's elected, this is his last term, Donald Trump, right? Whether you like him or not like him. If he gets a Republican Congress, he certainly has the means to repeal the ACA and introduce some plan of his own, right?
Of course, if he controls the House.
He doesn't control the House, or even the Senate.
Yeah.
There'll be a barrier there, so he won't be able to get it passed.
Yeah, he would need, the 51 votes in the Senate with the vice president. I will say that members of the Republican caucus in both the Senate and the House have privately urged the Trump campaign not to go down this road again.
Campaign reasons or?
Campaign reasons, I think it's hard to explain to Americans, that's something that's now been around for, let's say it passed in 2010, and, took 2-3 years to kind of get up and running. So it's effectively been in place for 10 years. And I think a lot of folks have felt that there hasn't been a viable alternative that can, and even if President Trump were to put forth an alternative to the Affordable Care Act and seek its repeal, whatever happens in November, it's going to be the narrowest of majorities in both the House and Senate. Right now, the House is dealing with a one vote margin, and you can see how difficult it is for them to pass virtually everything. The Republicans can't pass anything alone. Essentially, they need Democrats, and then the Senate is complicated because you need buy-in from both parties in order to pass most legislation. So I think, and this is very much just talking campaign rhetoric. Democrats tend to win healthcare arguments and tend to benefit from that on the campaign trail. So I think that's why a lot of folks are hoping that President Trump does not go back down that ACA repeal road. But at the same time, he might propose other ideas, things that we've talked about and things we will talk about, like the most favored nation model for drug pricing, things that can help bring down the costs of healthcare for the average American. And then, a few weeks ago, the president announced, what repeatedly what his position was now that the Supreme Court had struck down Roe v. Wade, and ultimately he said that this should be left to the states. So we're seeing this play out nationally now. We're seeing, Arizona, we're seeing Florida. There's going to be a number of state referendums. We've seen conservative states vote to keep the right to abortion in their state, and this will, again, continue to be a big focal point for the campaign season ahead. But to your question, what is the legislative reality of what really can happen? And here's a timeline of what's facing us. So 2024, these 5-6 months, has been probably one of the least productive times in Congress. And I think Democrats and Republicans would both gladly admit that. We had a speaker who was removed from office via a motion to vacate process by his own party. We haven't had a government shutdown yet, but we've been on the brink of a government shutdown multiple times. We've had appropriations bills that haven't been able to make it through the Rules Committee. We've had bills that have failed on the floor. So even the most basic elements of governing through the Congress, which is essentially just passing appropriations to fund the government, Congress controls the purse, has been an incredible struggle. So in June 2023, President Biden and then Speaker McCarthy, made a deal on the Fiscal Responsibility Act that set parameters for spending levels and appropriations process, but also suspended the debt limit until January 1st, 2025. So that's a fun thing that they're going to have to deal with as soon as the election is over and they come back during the lame duck season. Fiscal year 2020, we were 8 months into fiscal year 2024 when they finally resolved fiscal year 2024. So the appropriations process has begun in 2020 for fiscal year 2025. But from what I'm hearing and even conversations I've had with others, the conversations really aren't going anywhere on the Hill. What's most likely going to happen is, the federal government's fiscal year ends on September 30th. I think what you're likely going to have is a continuing resolution to keep the government's funding flat. That will bring us to sometime after the election, probably right around Thanksgiving. Maybe they kick it to December, but we very well could see, again, the outcome of the election is going to be a big factor. Will they come to some sort of agreement to fund the government, or will they kick that into the next Congress as well? And I think the outcome of the election and the margins that these members are going to face, these leaders are going to face, is going to be a huge determinant in that. But some things can, I won't say will, but can get done by the end of the year. And Democrats and Republicans in both the House and Senate have laid a pretty robust groundwork of policy priorities that they would like to see accomplished in this Congress. And just tomorrow, actually, the Ways and Means Committee will be marking up legislation that would extend the telehealth flexibilities from the COVID-19 pandemic era for an additional 2 years. Hospitals at home for 5 years. The low volume and Medicare dependent hospital programs for 1 year. Some new requirements on durable medical equipment, a study on clinical lab requirements, or clinical lab ordering via telehealth. So there's a lot of things in that regard that they want to get done. And I will say telehealth, I've been doing this a long time, telehealth, even before the pandemic, was something that was bipartisan, something folks really could get behind. The pandemic obviously showed Americans and policymakers that telehealth works, that it is possible for patients to receive care virtually, that the licensure can be offered across state lines through various compacts and other waivers. But telehealth is also expensive. What happens in Congress, why a lot of legislation, a lot of good ideas doesn't move, is the Congressional Budget Office that predicts what the impact of any piece of legislation will be for 10 years. And the complication with that is how certain CBO and others have viewed telehealth is more of an additional service rather than replacing a service. So for instance, it's midnight, you got an ear infection, you do a quick telehealth, with a .com kind of company. maybe they prescribe you an antibiotic, maybe they don't. 2 days later, you still don't feel well, you still go see your doctor. Maybe it reduces that emergency room visit, but you still go to the urgent care the next day. But there are a lot of benefits to telehealth, and I think there's a lot of education. And studies have been done showing that despite a lot of the fear around telehealth, during the COVID-19 pandemic, there really wasn't a lot of fraud and abuse that came out of the telehealth offerings. And that's why I think you do see a lot of members of Congress in support of it, but like I said, it's expensive and they have to find a way to pay for it. Pharmacy benefit managers, the PBM reform. PBMs are the middlemen, between the insurers and the pharmaceutical companies. It's an industry that has a lot of interesting terms like spread pricing and rebates, and it's a very complicated industry that doesn't have a whole lot of transparency in the eyes of Congress, and they have been pursuing legislation in both the House and Senate on a bipartisan basis to kind of rein in the role of PBMs in the drug pricing. Transparency requirements, we talked about that. The doc fix is a huge issue right now. Congress did provide some relief to physicians this year from the cuts they were scheduled to get. I think it was like 3.37% in the physician fee schedule. They are now looking for ideas on how to reform physician payment, but they're going to be up against another cliff at the end of this year that they're going to have to figure out a way to pay for that. And a lot of members of Congress that are physicians, mostly on the Republican side, and really good thought leaders on a lot of these issues. A lot of them are retiring this year, so we're going to be losing a lot of institutional knowledge on the healthcare system, and we'll have to see how all that plays out. Then site neutral has been a hot button topic on Capitol Hill. Again, a lot of that emphasis on transparency and why are you paying more in this setting than that setting, or for this doctor and that doctor, has yielded a lot of focus on site neutrality. And MedPAC and others have spoken about this for a long time. And there's a lot of rhetoric out there about hospitals buying up physician practices so that they can charge more facility fees. And so Congress has taken a look at this, and what started as a $100+ billion cut in site neutral payments, really reducing services based on volume or fee payments based on volume, has been dwindled down to a site-neutral payment for drug administration in a hospital outpatient setting, and I think that's somewhere in like the $2 to $3 billion range in savings. That has passed the House of Representatives in the Lower Cost, More Transparency Act. The Senate has not shown as much of an interest in site neutrality. There are a handful of senators, Senator Braun of Indiana and Senator Hassan of New Hampshire, that have pursued some of the site neutral.
Could you explain site neutrality?
Oh yeah, sorry. So site neutrality is basically, rather than paying a hospital rate for a service provided in an outpatient setting, they would be paid the physician fee rate. So a way to lower costs and lower spending. Where that ultimately goes by the end of the year, I don't know. I mean, the hospital industry at large has been pushing back hard against site neutrality, but they do have a lot of things that they need to pay for. So it is possible that this provision related to drug administration could find its way into an end of the year package. So we'll have to see how all that plays out. I think it's more than likely that we'll see some leadership changes in a second Biden administration. Rumors are circulating that HHS Secretary Javier Becerra is likely to go back to California to run for governor. So it's unclear who would necessarily ascend to his position. Chiquita Brooks-LaSure is the CMS administrator. She is well regarded. She would certainly be a candidate if she sought to stay in the administration. Of course, there's governors, there's health policy experts, depending on the makeup of the Senate. President Biden may pull one of his former colleagues. So we'll have to see how all that transpires. But I think more likely than not, it's unlikely that Secretary Becerra will return in 2025. So the Congressional Review Act is an interesting option. And what it essentially says is, in the next Congress, the House and Senate, with just a simple majority, has the ability to repeal any rules that the previous administration did up to a certain number of days. I think it's 60 days, 60 legislative days prior to leaving office. And this is really in place so that, January 8th, an outgoing administration doesn't just throw out, 40 regulations, and then the next administration has to live with it. So, of course, for the Congressional Review Act to be implemented, President Trump would have to be in office and would have to control both the House and Senate, or get some Democratic votes. We haven't quite hit the Congressional Review Act date yet, but it's certainly coming up once we know exactly how many legislative days are left in the calendar year. That's why over the last few weeks we've seen a plethora of rules and regulations come out of the Biden administration, and these are beyond the IPPS and physician fee schedule and OPP, the normal ones that we expect every year. We've seen a reproductive healthcare privacy rule, the non-discrimination 1557 Medicaid rule just came out last week. There was a nursing home staffing ratio rule that just has been proposed, and access to Medicaid services. So should President Biden be reelected, you would essentially see all the rules and regulations that he's put forth become finalized and remain in place.
And how many days?
60
60?
legislative days. So keep in mind that doesn't sound like a lot, but Congress is here now through Memorial Day. They're here a little bit in June. Then there's July 4th, then the Republican convention, then they're out all of August, then there's the Democratic convention. They come back for a little while in September. They're out the entire month of October for campaigning. And
Do you have a calendar on your wall?
I do. Yes. All right, well, I got the 10-minute cue, and I think we're actually getting close. So these are...
Anything 60 days prior would remain.
So like when that
Would not be affected.
date hits,
Mhm.
any rules that come out after
Right.
would be optioned for the Congressional Review Act. Yes. So these are some of the organizations that President Trump leans upon. Brian Blais, Paragon Health Institute. You'll see here just kind of the conservative think tanks that he relies on for a lot of his healthcare agendas. CMMI is a driver for innovation. Actually, Congress is looking at the role of CMMI and some of their policies because they've actually shown to actually increase the cost of healthcare. So that's going to be interesting. But again, I think a second Trump administration would very much revert back to a lot of the policies that he originally implemented in his first term. Then a lot of those were repealed or rescinded by the Biden administration. So I think it would be kind of like a repeat. So priority versus reality, what actually can get done.
Before you do that, could you just explain CMMI?
CMMI was a function of the Affordable Care Act, is the Centers for Medicare and Medicaid Innovation. And it's essentially kind of like they do pilots and miniature models of certain healthcare delivery options, systems, etc., to see if it's something that can be scaled greater.
Like the accountable care worker.
Yeah. So, what will confront the next president? So, regardless of what they think might happen or what they think their agenda is, you can see here they're going to have a lot on their plate, even if healthcare isn't their number one priority. Cybersecurity, the Change Healthcare attack, which some of you may have been impacted by, I think there's going to be a lot of conversation. There were 2 hearings last week where United Healthcare's CEO, Mr. Whitty, was brought before the House and Senate to explain what happened, why certain things didn't happen. There's been discussion about whether or not there should be mandates, conditions of participation on hospitals to have cybersecurity minimum standards. Who's ultimately going to pay for this? It's going to be a big question, and I think it's safe to say that the change attack is probably, it's the worst that's ever happened, but I doubt it's the last. Artificial intelligence. I think people have been talking about AI for a long time, but it feels like a year and a half ago, ChatGPT came around, and then all of a sudden Congress was obsessed with AI, and they held all these roundtables and hearings. But really, what role does AI play in healthcare? Is it like telehealth? Is it something that physicians and hospitals and providers utilize as a tool, or does it do more predictive modeling? How do we ensure that AI isn't discriminatory and doesn't ultimately harm patients? We talked about the funding cliff for the enhanced subsidies, telehealth, opioid crisis continues, and fentanyl continues to plague the nation. The role of 340B and its future, and what kind of transparency requirements could be put into place, depending on who's in the presidency. Consolidation has been a major focal point of both administrations, really, and vertical integration. And vertical integration is, rather than this hospital buying up this hospital, it's more like an insurer buying a hospital. So vertical integration is more like joining with other forces that aren't on your level, but controlling other aspects of the healthcare industry. And the FTC is looking very, very closely at this. PBM scrutiny, Medicare Advantage trends, the No Surprises Act, which has been put in place, passed into law in 2020, President Trump signed. I worked a lot on that legislation. To this day, it is still plagued by lawsuits, complications with the quality payment amount, the arbitration process. I can't remember the exact number, but I think they were expecting something like 80,000 cases, and they ended up getting 400,000 cases. It's been a pretty hefty burden, and I think Congress may ultimately have to look at doing something on that again. The growing role of private equity in healthcare, buying up physician practices, and we just saw what happened in Massachusetts with a hospital system that ultimately was private equity backed, but had to declare bankruptcy. Increasing federal debt and deficits, though we received some good news yesterday that the Medicare Trust Fund has been extended surprisingly an extra 5 years to 2036, mostly due to a year ago they thought it was going to be in 2031 because of the strength of the economy at the moment and the payroll tax and fewer utilization of services. And then in 2025, President Trump's landmark legislation, the Tax Cuts and Jobs Act, that is set to expire, so that's going to be a huge battle on Capitol Hill.
Excuse me.
Yeah.
Could you explain the No Supplies Act?
Mm-hmm. So in 2018-19, members of both the House and Senate, Dems and Republicans, started, and really Sarah Cliff with the New York Times began a piece that was sharing stories of patients who were getting surprise medical bills. So, and essentially what that legislation did after months and months and months of negotiation was it ultimately held the patient harmless, and so that, as long as certain conditions were met, if they were in an out-of-network, if an out-of-network provider or an emergency room saw them, but it was outside their control, they wouldn't be hit with, a $100,000 fee because they were out-of-network. But it also set up an arbitration system where insurers and providers could appeal any sort of payment discrepancy, and then an arbiter would decide based on the offers what the ultimate payment would be.
New York State has a comparable law.
So what passed in the No Surprises Act is based very much on the New York arbitration process.
That's good to know New York was in the forefront.
You were. Impacts on coverage, Medicare Advantage, More than 50% of beneficiaries are now on MA. MA is under a lot of scrutiny on Capitol Hill right now on issues like prior authorization, upcoding, delayed payments. We already talked about the drug price negotiation timeline. Here you can see the $2,000 out-of-pocket cap that's coming for Medicare Part D beneficiaries. Medicaid, coming out of COVID, we saw a great number of Americans in a number of states that were ultimately kicked off of Medicaid. Many of them were able to pick up healthcare through either the exchange or an employer, but we haven't quite seen the true impact of that. See here, you can see.
I'm surprised California is on the list.
Yeah, that is a little surprising, but probably just because of how large of a state it is. But again, here you can see, 47% re-enrolled in Medicaid and 28% found other types of insurance. So 23% are now uninsured. Talked about the ACA marketplace. I think, should the enhanced ACA subsidy stay in place, we'll likely continue to see growth. Here you can see the coverage gains. As we've seen, the uninsured rate has continued to decrease since 2010, as well as the number of uninsured Americans. At the same time, healthcare expenditures continue to rise, and at a certain point, there will be pressure on the Congress to find ways to lower costs, and when and if that day ever comes where the Medicare Trust Fund ultimately is unable to meet its obligations at 100%, the two options on the table are increasing taxes or reducing payments to providers. And here's our national debt at about $35 trillion. That's $102,000 for each of you. And where does this all leave us? Who knows? That's it.
Could you touch base a little bit upon value-based care and outcome-based care? Is there any push from DC about that? We've been hearing this since 1932, since the CCM, report came out that integrated care and captive payment model. So it works. Preventative care is really that's where it all comes around. But what is DC doing to push that onto us?
I think a lot of people talk about it,
Yeah.
and it's in a lot of press releases and studies and that sort of thing, but I imagine fee-for-service is kind of the way it still works for most
Why
of
is
it.
that?
Change is slow.
Changes it.
Change is slow.
You have seen a shift into the value-based payment arrangement,
Yeah.
haven't you?
Yeah, I think so.
Country,
Yeah, I think so. And
from the commercial carriers.
yeah, and
Medicare started that,
yeah,
and the commercial carriers seem to have picked up on it, negotiated contracts.
yeah, and I think that's probably the direction things are heading. It's just, like I said, it's slow. It's really, really slow. Any other questions?
Yeah, I'm gonna ask one question.
Yeah, go for it.
I recently been doing more reading into private equity and how private equity is playing a role, not so much in New York,
Mhm.
but certainly outside of New York. You mentioned the hospital system, I think it was in Massachusetts, that at the problem of bankruptcy after being depleted so badly, private equity concern. Where do you think that's going to go? I mean, it's being scrutinized by the Biden administration. I think even the Federal Trade Commission is getting involved with that. So, where do you think this might go with private equity? And if Trump were elected, do you think that there would be a more favorable environment for it?
That's a good question. I'll do the first part. I would think that the Trump administration would be more sympathetic to the role of, private business, supporting other businesses. And, in terms of private equity, it's a real question mark for a lot of folks because, there are other hospitals and providers and healthcare systems that would either fold or, I've spoken to some providers who, merged or were incorporated into a private equity model, and they're saying, well, I have more time to focus on my patients. And we're seeing that with a lot more students coming out of medical school. They don't want to deal with all the bureaucracy and the regulations and the filings. If they can just work for someone else rather than have a private practice, and maybe they make a few bucks less, but then they can really focus on what they went to school
It's a
for.
private equity model that they're taking money from investors, right? And in turn, they're putting that money into some healthcare entity.
Mhm.
Or they're taking over the healthcare entity. To bring it to a point, usually it's a healthcare entity, it has some weaknesses, and they're building it up to the point to make profit. Right? Okay, now they made their profit, and they can give a good return to the investors, and then they sell it off. They don't want to be in the business of operating a healthcare organization on any long-term basis.
Yeah,
It's a short-term endeavor, right?
that's
Sell it to another private equity company that's gonna try
Well,
to.
they can do that too,
Yeah.
that's right. Yeah,
They just went into the bigger one.
that's right.
it's not something I can really comment on,
Yeah.
but I will say, FTC is looking at it. I mean, I think you hit the nail on the head. There is a lot of scrutiny. Senator Markey and Senator Warren of Massachusetts held a field hearing in Boston not long ago. Senator Markey has put forth legislation that would require a lot more transparency in the role of healthcare, private equity in healthcare, making sure there's a certain amount of cash reserves if there's any sort of system is in financial trouble. But there isn't a whole lot that can be done legislatively beyond some transparency. I think it's unlikely that they could ban private equity's role in healthcare. I think it's the direction a lot of the healthcare system is headed.
Do you see any areas where the antitrust issue could come up? I don't think you've experienced that under the Trump administration, but certainly if Biden was reelected. And presently, there are some cases, I think, that are being challenged in antitrust in healthcare.
Sure. There have been some mergers that have been squashed by FTC, and I think you'll continue to. I think if the Biden administration is reelected, you'd certainly continue to see that.
What a quiet group.
You can ask me anything.
Come on, ask him. This guy's in the middle of everything going on in Washington.
Tell us about the childhood acting.
Can we stop recording? When I was a kid, I lived in LA for a little while, and I tried acting and tried getting on all the Disney shows and all that, and just didn't go anywhere. But I have my headshot if you want to see this. Denim shirt, braces. Yes.
How would a government shutdown affect your day-to-day?
That's a great question. Because I've lived through a few of them. Shutdowns are chaotic because there's a lot happening and there's nothing happening. And at the end of the day, the only way out of a shutdown is for the four corners, the House and Senate, Democratic and Republican leaders, the four of them to get in a room with the White House and solve it. So what you end up seeing when you go to Capitol Hill, and keep in mind, when there's a government shutdown, most federal employees are furloughed, not all of them. But in terms of healthcare, Medicare payments would still go out, that sort of thing. But when you're on Capitol Hill, it's kind of funny because the congressional offices don't close. The staff are still there. The members are still there. They're all waiting to vote. So they're all kind of just walking around, doing nothing. And I've actually had a number of clients come in on fly-ins. And fly-in is when you bring everybody from an organization, association, et cetera. Like if you all came down to Washington, we hit the Hill and you met with all your House members and your senators. And I've had that happen during a shutdown, and it's great because you'll have a U.S. senator sitting in the lobby of his little office, just, you know, reading a magazine in a newspaper, and then you walk in there and he just, you know, he or she is just happy to chat with you because they don't have much else to do. And the longer the shutdowns go, the more painful it gets because, you know, a lot of millions and millions of Americans are affected. It's terrible for the economy. No one ever comes out of it looking good. And usually whoever caused the shutdown usually looks worse at the end. That was a good question.
No other questions?
Yeah.
So, Jonathan, regarding your objectivity that you have expressed in terms of the both administrations, do you have any opinion whatsoever on what would be best for the
He wants to know.
years ahead? Yeah, I mean, based on your vast knowledge of the healthcare, situation, what do you think?
I think a continued investment in the system we currently have is probably the best path forward because it's not a light switch. You can't just shut off what we have, and whether that's a repeal of one concept or movement towards a single payer kind of system. You know, this is the system we have. We have an employer-based health insurance system. We have hospitals, we have doctors, we have Medicare, we have Medicaid. What I would just love to see is, you know, healthcare spending, Medicare, you know, that's mandatory spending. So like that doesn't come into the fights over government spending at the end of the day. But folks need to understand that investing in healthcare today helps lower costs in the future. So one idea that actually the House has just worked on that I like a lot is, remember I told you about CBO and the 10-year score? Well, a lot of folks are frustrated in that in terms of healthcare because that's not like a tax cut that you can probably predict what it's going to do over the course of 10 years. We don't know what preventative care today means. Maybe we can predict it in 10 years, but maybe in 20 years, that patient is healthier than they would have been. Maybe in 30 years, they live longer. Maybe they don't need to rely on hospital services so much in the future. So I would love to see a way for our projected spending to take greater account preventative healthcare. Because I think that will ultimately reduce healthcare
It will
costs.
certainly be a major shift because doctors go to medical school to learn to take care of the sick.
Right.
To take care of the well. And hospitals are built to take care of sick. So the entire system, you might say, and even the insurance companies, they're designed to pay for sickness. So you really have to make a major shift of all parties concerned in thinking differently and paying for a much different outcome, than they're paying for now.
But, you know, it's incremental. You know, we have an annual wellness test that's free.
Well, the entire healthcare system in the United States is all through income. And sometimes setbacks.
Stuart Oldman's got a great book about the history of healthcare in the United States that I recommend you read. I mean, you know, when the hospital system really kind of came about.
But it's also a battle of hearts and minds, right? And people have to be willing to change, right? Whereas right now it's like, well, no, I'm just going to keep on living the way I'm living. I'll take this extra pill, and that'll be it. Damn the consequences.
Well, and of course, pharmaceuticals are only going to get better and better. I read today about how the mRNA vaccines, that technology is being used for cancer treatments, and I think I have bladder and kidney and certain breast cancers that it can target the tumors and initiate an immune response.
Well, they got the blood test, right? That test for 50 different cancers.
Yeah.
Well, as I usually say, and first of all, thank you very much.
Sure.
Very much.
My pleasure.
It is a change in in our mindset. I don't see that happening no time soon in terms of really bringing a balance to healthcare in America. And some of you may have heard me say this before. Healthcare in America is governed and ruled by Wall Street. The concept of preventive care and public health really is at the lower end of the spectrum. And so we spend a lot of time analyzing the outcome of care, and we look at the value system and investors and people like me, the nurses, doctors who actually provide care on the operations side, that really see the effect of these brilliant studies and policies that are implemented that really doesn't bring the help to the actual patient, really continue to be frustrated. So as we say, we do the best we can, we do it in increments, we get gains, take the gains that we have whenever we get them and try to do the best that we can, always focusing on our patients in our community. Thank you very much. This was excellent, as I expected. And welcome to come back. We'll be
Thank you.
talking.
Maybe I'll come
Thank
back in
you.
2025.
Yes, let us know
You can
what's
see what I got
happening.
right and wrong.
And Dennis?
So Jonathan, on behalf of everyone here and the 5 professional associations that collaborated for this event this evening, we want to thank you very much.
Thank you.
This is a token of our appreciation.
Thank you.
This plaque, okay, and I hope you put it somewhere that it can be seen well, and it's nice if it's by a window because the light comes right through.
I love it. Thank you.
Okay, so
My office is actually, we're connected to Ford's Theater, so my office is in a window that overlooks the alley that John Wilkes Booth ran through.
Oh, yeah.
So that's where this.
that's something to talk
that's where
about.
this
That's
will be.
something to talk about. Yeah.
Does the coach still run?
Well, thank you all.
Okay,
Appreciate it.
thank you.
Thank you.
So.